What are the risks of the PAD revascularization procedure? What are the potential complications?
So the PAD revascularization procedure that we do is a minimally invasive image-guided procedure. That means it's not surgery in the traditional sense. Surgery is a large incision, general anesthesia, big operation like a knee replacement or a shoulder replacement or a large removal of a large tumor from the abdomen. This is nothing like that. It's a small hole. We make a small hole in your groin and we enter the femoral artery. And we see what we're doing using fluoroscopy, which is like real-time X-ray, and a little bit of ultrasound. So it's a very innocuous procedure, just a small hole in your groin. You don't feel anything. You have sedation, not general anesthesia. You don't have a breathing tube. You have conscious sedation. So you're asleep, you don't feel anything. So our procedure is minimally invasive and it's innocuous and mild. So for that reason, complications are exceedingly rare. So here's the disclaimer. Any medical procedure, anything, you're gonna have to sign an informed consent, and they're gonna list a lot of complications there. And those are theoretical complications. Bleeding, loss of blood, and blood pressure problems. And yes, in theory, those are complications, potential complications. I will tell you those are exceedingly rare. It's a very safe procedure. The most common complication we have, which is still not very common, maybe 1 out of 100 patients, is a groin hematoma. Where we access your artery in the groin, blood will kind of collect in a ball in the groin. Not a severe complication. Generally, you watch it and the body resorbs it. It's like a big bruise, basically. Occasionally, a patient will have to come back and be admitted to the hospital for a night. Very occasionally, maybe get some blood. Again, this is very rare. In general, our procedure is very safe, outpatient, go home the same day, infrequent complications. Versus, if you compare our procedure, PAD, minimally invasive, image-guided revascularization procedure, versus the alternatives, open surgical bypass, that's a much more invasive procedure. That's surgery, general anesthesia, intubation, big incision, replacing arteries and bypassing them. Hey, if you need that and your arteries are so occluded that you have no choice, then by all means, our vascular surgery colleagues do a very good job of that. That is a more invasive procedure and the risks are a little bit higher. So with us, the risks are very low, the complications are very rare. And when you come to us for evaluation, and if you meet the criteria for procedure, we will certainly discuss those with you in more detail, but rest assured, complications are rare and risks are low.